Hey everybody, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation. And today we are diving into payment model innovation in, oh yes, the value-based care model type of world. And to help us understand what's going on with some big news that they're here to announce, we have Kyle Armbrester. He is the CEO of Signify Health. And from the state of Connecticut, we are meeting their comptroller, Kevin Lembo. Hey gentlemen, how are you?
Great. How are you?
Good. Okay, so the big news that you guys have is that the state of Connecticut and Signify Health have come together and you guys have earned the first ever episode of Care model to have received CMS's designation as an advanced alternative payment model for the under 65 commercial market. That is a mouthful, but this is a big deal. And Kyle, I'd like to start with you and you can explain to us why this is so important that you guys have earned this designation specifically with an episode of Care model for that under 65 population. First time ever been done.
Yeah, absolutely. And I'll give a little history, maybe like what led to this moment too. And so macro healthcare landscape, the Medicare trust is due to run out of money in 2026. States and their pensions and their medical budgets aren't much better, right? Costs have just gone completely unchecked and don't match to better quality and don't match to better patient outcomes. So everyone's super aware of that. And that's why value-based care is the topic du jour right now, because folks are fed up with it and trying to push forward. Over about a decade ago, the federal government, CMS, put together a bunch of different alternative payment programs. And one of the largest that they put out was a program called BPCI. So that's
okay, what does that stand for?
Yep, bundled payments for care improvement. It went through its first iteration. It was very successful. And basically a bundled payment an episode gives guaranteed savings to the risk-bearing entity. And then you go downstream to the providers and help drive alignment for a period of time versus just the procedure, right? And so as a provider, I'm going to be on the hook for rehabilitation or where I do the surgery. And I'm going to be taking cost and quality and outcomes into account over the entire episode of care versus just a specific point in time. And the program is a big success. They extended the program and now we're live in what's called BPCIA, which is the bundled care bundled payments for care improvement advanced. So it's the second iteration.
Okay.
And the federal government has been big and saying that they really love the program. One, there's guaranteed savings. We're saving the trust money, which is great. But number two, they wanted to see and promote innovation out in the broader healthcare market. And what's so exciting about this is the state is one of the first ever to step up and to really do it at scale. And CMS is recognizing that through giving them this advanced alternative payment designation. The AAPM is what it's called. And basically the providers who are a part of the network of distinction that the state has helped build out can get quality payments now from CMS for doing the right thing, for delivering more affordable, higher quality care, which is what we all need. And so it's a really big deal. And the state has been way out for years, I would say. And I think it's a great way for Kevin to kind of walk us through that, pushing the needle, demanding data transparency and innovating. And we couldn't be more proud of them and to be a partner with them and to have earned this designation and be the first in the country to do it. It's really exciting.
No, it's very exciting. And Kevin, I want to give you an opportunity to chime in here. And I think just to put a little bit of context about just how big of a deal this is, it's you're talking about a state plan here that has 220,000 employees and retirees in it. So, this is significant in the world of value-based care. And also too, that we're kind of baby stepping our way into it through episodes of care. So Kevin, chime in here and talk to me about the innovation coming out of the state of Connecticut in healthcare. Who would have ever thought?
Whoever said you couldn't learn anything from a state government, right? So here we are, and we're trying, and I think we're succeeding in many ways. And it goes back just to the very beginning. When I first became comptroller, we started really mining our data, and I got good advice from other plan administrators that said, "Get your data, know your data, dig." And we dug, and we saw things that were troubling. Outcomes were not great, and the cost of care was increasing at a rate that was unsustainable. Our TPA at the time wanted me to sign a non-disclosure agreement to get our data.
To get your own data.
Yeah. Yeah, so needless to say, our future contracts are all very clear about who owns the data.
You're like, we do.
Exactly right. And so it went from, a value-based insurance design attempt, and I got to say, like, labor and management came together because it's the only way in this environment where it really works. And labor brought it to the table, and the administration at that time agreed. And we were in a significant budget crisis at the time. So instead of just going in and doing I'll call it the dumb thing, which is just to go in and start hacking away at things and not really thinking about what the downstream impact is going to be, they said, okay, let's focus in on this because we know it'll help us now, but the long-term opportunity is amazing. And we went from that moment through to where Kyle described where we are now. And it's paying off dividends. And we know that the private sector businesses and some of the commercial carriers are watching and I hope cheering for our success.
We'll come back to that in a second, but I have to understand, okay, state budget crisis, that's not like a new thing right now, wanting to improve healthcare quality and outcomes, that's not a new thing right now. So why was now the time to do this? It's not even like value-based care is new or that episodes of care models are new. So what made this happen right now for you guys? I know this has been in the works for a little bit, for a couple of years now, right? But it's what was the thing that finally you were like, you know what? In my busy state comptroller life, the thing I'm going to focus on right now is this healthcare. So what was it that started you in this direction? Was it getting your data?
Well, yeah, it begins with that, but then it goes on to sort of see the things that we were paying for that weren't working and realizing if we extracted those out of the stream, we would save right there, and figuring out, well, if you put a little bit of preventative money here, you get a better outcome down there. And so because we're a public plan, because we don't have a profit motive necessarily, because our board of directors are the people of the state of Connecticut who demand that we provide this service and do it in a fiscally responsible way. And I hired a whole bunch of smart healthcare types and policy people around me. And so they just churn ideas. I don't want anybody to think this is just me thinking. This is like a group of people who really understand that when you've got a group this size and you know what's happening isn't working, you can really innovate if you find the right partners. And I think we did.
Well, Kevin, I think that's what makes it so impressive is that you've taken along a lot of stubborn stakeholders and convinced them to go this innovative direction for you. If it was just you, it probably would have been a lot easier.
In the private sector, you just do a thing, right? But
just do it.
Everything is negotiated.
Yeah, and I think too, we were chatting before, and I think in the context of too where you're at, in terms of your leadership role in the state of Connecticut, you're responsible for a lot of things, not even just healthcare, and a lot of times in this situation, and I think, Kevin, we'll start with you here, but Kyle, I do want you to weigh in on this. One of the things that I think always comes into play whenever we're talking about healthcare is healthcare organizations, the health systems are typically large employers. In an area, in a local area, so Kevin, how did you convince all of these stakeholders to, kind of join in and at least keep an open mind in terms of, moving forward and really looking at this and taking it apart and then rebuilding it into something different?
So I think there's multi-prongs here, right? And Kyle may either disagree or have others that I'm not thinking of, but one is to get at the folks that that are providing great service and have been for some time, but for one reason or another are not recognized in the market because maybe they're not the big brand. We've got two huge hospital systems, vertically integrated, big, and we were a little late, Connecticut, to that phenomena, but it cuts both ways. We don't always see all the promised efficiencies that were supposed to save us money. But there's those other hospitals in those same universe who were doing knees and hips and colonoscopies and doing all these things with a high level of quality at a lower cost. And so they were early to the table. The folks who were doing it well, who felt like we were putting quality first and then talking about money second, finally got it, because we've heard for years this idea that, okay, we can save you money, we'll put more barriers between patients and your care, and we will find the cheapest providers we can find, and therefore your premium will go down. Well, that's not where we want it to be. That's been tried and that's failed, and frankly made things worse as we move forward. Quality first, negotiate money that really makes sense and incentivizes the right kind of care, and respecting them as the provider.
So Kyle, weigh in on this for me, because this is Signify Health, you guys always have taken this very bundled approach, very quality outcome focused approach, but rethinking that, oh, fee for service, let's just flip the switch and, our entire business will just one day, recalibrate as a healthcare organization, or, our plan will completely recalibrate to a bundled payment model. It's not that simple. You have to really, break things down, talk through that a little bit for us, because you guys have experience in terms of just how to even look at from a macro perspective what you're dealing with as far as the model of the way healthcare works and how the dollar flows through it. So talk a little bit about that shift in thinking that has to take place.
Absolutely. I mean, the first thing you need is a large aggregation of lives, and the state has that, right? And they've got purchasing power, and they've got the ability to demand data and transparency, not to just harp on what Kevin said, but it really does start with that. And what we do as an organization with the state is we sit down with the providers and we'll talk to a doctor, and she will round somewhere and provide the same service at a local with the same equipment, the same colonoscopy, whatever it is, the exact same thing for half the price. And she never had that transparency. She didn't know what the charge master said. She didn't know what the facility versus the pro fee breakdown was. So giving transparency to these folks, it helps the providers say, well, wait, like I want the state's volume. And if I'm doing the same thing and I'm getting paid the same amount, like I'll go to another care setting where I can provide the same high quality care. And so it's caused a lot of behavior change and shifts. And one of the things that we at Signify do is sit down with these providers, with the state, and are coaching them constantly. They want to get better. They're looking for care, innovation and redesign. They want to better engage with the state employees when they show up. They want to follow up, and we help them make that a reality. And the other thing that I think that really differentiates what we're doing with the state, this is not just a clinical program. We are doing a ton of social and behavioral and holistic care with folks. And that's what drives folks to be healthy and better and get back to work, or is saving, unnecessary costs by better managing them in a preventative holistic fashion. And so not to just beat on the drum, but it comes down to data and benchmarking and conversations. And I will say we've got 1,400 clinicians now live in the program. That's a ton of providers. And they are sitting down, digging into the data, thinking of new innovative ways, and looking to be competitive, right? Because what Kevin and the state have created is an opportunity to actually shop for healthcare with data behind it. And providers are willing to play ball, right? Like now that they can see there's a market, they know their services, they can see where quality's at, that they're starting to change behavior to be more competitive with outcomes always at the forefront. And it's extremely exciting to see it scale.
And just so I can just add to that for a second, this comes down at its nexus from conversations between the hospital executives and my office, where they said, you should talk to us directly. Now, I don't know that they fully anticipated that would be a sophisticated negotiating.
Maybe they weren't expecting such a frank conversation. They were like a "how are you doing" kind of conversation, right. Not like "I have my data now, I'm not right. signing
Here's
NDA.
Your discount, take
right."
But it's, look, you're right. You got to balance the care delivery system, and the bigger the systems are, the more pull they've got, whether it's at the legislature or with their staff or with their patients. And the bigger they are, the more complicated the negotiation is. So, those folks are a little slower as they come on board, but those rings around them start to pull things away from them that they don't want to see go away. So I think it motivates folks to really get in the game. And the other thing I'll say is, if we can do things to control costs and to improve quality, or I should say them the other way around, that doesn't stop with us. I mean, the CMS designation is one thing to consider, but the other is when a provider or a group of providers change practice patterns to deliver better quality, that doesn't stop with us. It's not like, oh, you're not a state employee, I'm going to give you the lousy care, right? No, it's like it happens across the whole system. And that's great for folks who never received a dollar of benefit from the plan that is starting it.
Yep.
Well, I mean, it sets a precedent too, I think, for a lot. I mean, not only other states to look at, but also, other large employers, like self-insured employers in your area, to follow. So, I mean, it definitely has that potential to really, prove the use case for episodes of care and that value-based bundled approach to payments and the cost savings and the better quality outcomes that come from that. Right. Kevin, I want to go back to one thing that you said really about, wanting those meetings with those large healthcare systems to talk, and how, that as you kind of pulled out of that, there were other rings of people people whose perspectives kind of got brought into the fold. I talk to a lot of health tech companies and a lot of like very innovative new healthcare organizations, Signify Health being one of them. How important was that to have like the voice of like, like a newer healthcare organization that doesn't have like the years of history and the years of legacy kind of, thinking, at the helm? How important is it to have that, more, I guess, entrepreneurial, like an innovative voice, disruptor kind of voice at the table when you're talking to something like that? And I mean, nobody, no offense, Kevin, but nobody really expects that at the state, at a state government level to see such innovation.
Look, I think it's finding the right partner. And I think we've tried to foster internal to the office that entrepreneurial sort of like, let's go to work every day as if our income depends on our success, right? So the team that I have around me really comes in and starts to think. It's not like they're just marking time, and hoping for a pension at the end of it. So A, get the right team, and B, find the right partners. And I think, I don't know, maybe kind of made us like a hipper, cooler organization in all of this, but it is the right partnership because we speak the same language, we come from different experiences, but we've got a common goal. And we know the upside for everyone if we're successful.
What is this? Go ahead, Kevin.
Yeah, really quick point there. The cool thing there, the only way that we make money and that the state makes money and that the providers make money is if there's better care being delivered. And that alignment across the entire supply chain, like I've said this to you before, Jessica, but the days of the PM piranhas per member per month and everyone's claiming they're solving everything, like plans aren't taking it anymore. Big self-insured employers aren't taking it anymore. Provider organizations won't take it anymore. And it's a great way to get yourself killed in a procurement process. But if you're not directly attached to superlative results that are driving better outcomes at the end of the day, and taking risk for it, right? Like it's a very important new mindset that folks need to embrace.
And I feel like I'm seeing that more. I mean, just like looking at the industry and luckily I get to talk to the most innovative people in it, but I feel like I'm seeing more of that. I'm seeing more at-risk models, but it's been a long time coming. And I remember we were talking, the end of PM back when I worked at a Blues plan 6 years ago. I mean, and so it's like, it's been a slow death for that model. It really has been. But I wanted to ask you guys, so in the context of this news that you're sharing with us today, the fact that this episodes of care model has earned this specific designation from CMS, it's being recognized, it's being offered to that under 65 commercial market. What is this signal to us, big picture, about where we're at with value-based care? Because, that's been the other thing too, is like, as much as you hear death to PM, it's like, oh, value-based care, not scalable, can't do it. It always peters out. So like, Kyle, start me off there, and Kevin, you can weigh in after, but I'm curious, like, what is this signal to the rest of the market here about where we're at with value-based care?
Yeah, I think you're seeing the ultimate payer / buyer of care getting fed up, and they can't afford it anymore. It's no longer sustainable, right? Like it's killing, the costs are killing innovation. They're killing the ability to go fund new things. They're killing the ability for organizations to thrive. And maybe some of them could have justified it if they thought that their employees were happy, better, healthier every day, but that's just not the case, right? We're not seeing better outcomes with all this dramatic increase in spend. And I would say the federal government's fed up too. I mean, the CMS and the initiatives that the Innovation Center have pushed through there, they have survived all kinds of political administrations, a lot of changes, Republican, Democrat, whatever you want to, party you want to affiliate with. Because there's universal agreement, even at the federal level, that we have gotten ourselves into a situation where the cost and spend is not matching the outcomes. And to me, what this represents more than anything is some of the largest buyers, like states, are putting their foot down. And Kevin knows this, but we constantly talk to insurance companies together that want to stack on top of the state's program. We talk to other employers, and other states and other markets are issuing similar RFPs, drafting behind what Kevin and the state have done. And so I do think, Jessica, that there's a tidal wave coming of that again starts with data transparency, which has been the single biggest failure of our last 10 years. Like we mandated EMRs, we put them everywhere, and we allowed them to sit in silos and the claim systems that they sit on top of. And there was no genuine demand for transparency and interop, et cetera. The government's made great strides, over the last year on that front, but you need the buyers, I think, like Kevin, to start putting their foot down and making changes. And Kevin's made a bunch of dramatic changes to get that data at the end of the day.
Kevin, add to that. as far as this, like, like this moment, this news that you guys are sharing with us today, what you've done for the state of Connecticut, for your own employees and retirees, health, and also like for the state budget, because that, the spend there gets reallocated elsewhere, right? So it's like that the entire fiscal health of the state improves through something like this. What is this signal, or what do you hope it might mean to like others who are looking in terms of like adopting a value-based care model and really, like Kyle said, like helping all those other, large self-insured employers or state-funded plans who are fed up and just haven't seen a good example that has worked. Like, what do you hope this means?
Yeah, well, so I think that's exactly it. We've gone through this horrible period of decades in some cases where big plans, self-insured plans with TPAs in particular, have the carrier pointing at the provider pointing at the carrier. We're sort of caught up in the middle, and all our job is to write the check, on a monthly, quarterly basis to reimburse. That's not enough. We have to, if we're really serious about this, we all have to lean in on it, and we have to sort of admit where sort of we've dropped the ball. The carriers, the providers, and frankly, the plan sponsors, by just taking our hands off and let someone else take care of it. It is in the interest of these large groups to make sure they have a point person who's doing this work and monitoring their TPA and trying to inject innovation or copy things that they see are going on. So yeah, it brings relief to the state budget. It brings better health to our employees, which is as or if not more important. We went from a time where we put like colonoscopy requirements in our value-based insurance design, right, in our health enhancement program, and I had guys like in the corrections office or the DOT shaking their fists saying, how dare you make me do this? And then we'd inevitably get an email from often wives, and I don't want to be sort of sexist about this, but often wives who in this case were clear of thinking, saying, thank you so much for the program. My husband, who hadn't seen a doctor in forever, found something during his colonoscopy and they fixed it and he's going to be fine. Mm-hmm. Well, that's good for him. That's good for her. And that's good for us because we're not finding a late stage colon cancer case that's going to cost us $1 million or more. And the patient's not going to survive anyway. Right. So these people that we serve are with us for an incredibly long time, and sometimes multiple generations through retirement and through death. So we've got them. So we can measure and tweak and make sure we move in a way that is accountable and follows the science, follows the data.
For those who may be listening and thinking this still sounds like it is so complicated, years in the making, an RFI, like, all this stuff, like, what's your best advice? Like in terms of just getting started in terms of reevaluating what may be a fee-for-service plan where you just are that check writer and instead changing your relationship in that triangulated relationship between plan, provider, and how do you get started doing that? Like, what's your best advice, Kevin? Did it start with asking for that data and having like been met with that resistance and then you just got fired up and that was it? Or like, what's your best advice in terms of somebody who might be watching this and even if they're not a state government, but a large self-insured employer or somebody who wants to just start looking at their health spend differently? What's your best advice?
I think the best advice is not to worry about whether the environment is right for this, because we know it is, and not to worry that the stakeholders aren't sort of wondering what's next and they want to be part of it, because all those pieces are in place. But to your point, it was owning the data, looking at it and being appalled, and a fiscal crisis that sort of forced us to act, and working with a team that's been in healthcare for decades in some cases. Some of us have been at this for a number of years, not just 5, 10, or 12. And so all of those things come together and you get to pilot these things. And I'd also say transparency, as has been said a bazillion times now, but transparency is important. It's important in the relationship with the providers. It's important with our communications with our members and their families, and getting at quality data that they feel is true and accurate and not skewed in a way as an advertising would be, helps them to make better informed decisions. The idea of high deductible plans were going to solve everything because grandma was going to have skin in the game is nuts, right? Because at that point, government couldn't figure it out, big employers hadn't figured it out, but we're going to rely on grandma to figure out sort of which hip replacement is better for her.
I mean, if you had met my grandma, I mean, she's pretty convicted. She's got all the answers.
Yeah, but most of us, I need my hip done. Who did you see?
Right. Yeah.
And
totally.
like, when you get down to like, well, why did you pick them? Well, Elsie had this.
Her hip done there.
She's doing fine, and she said he's a very nice young man.
Yeah, totally. That's exactly right.
That's not how we pick this. So it's changing everything, not only out in the system, but even with our members and how they view their responsibility for their health and how they're going to approach this. And they're demanding more, and they should.
Kyle, Signify is emerging here with a reputation as an organization that is I don't know, counselor, strategic partner, advocate, planner. You guys are helping not just, Kevin in the state of Connecticut, but, other organizations in terms of of implementing these value-based care programs. So it's what's your advice to the Kevins of the world, or you know what I mean? Those who might be are just how do you even start this? I mean, and don't give me a call Signify first kind of answer, but I mean, you guys have counseled others. And I'm sure that when you guys get into this, you're starting to recognize some patterns, or you're starting to know that okay, step one is really this. So give us some insight in that.
I think the thing that I would always say, and this was true at the state too, you have to be prepared to have a lot of doors slammed in your face. There is so much inertia to not change inside this space. And the game has been set up for so long to support complete opaqueness on price and quality. It is not for the faint of heart. And we will tell partners and folks we work with at the beginning, Kevin mentioned Lena and they hired the state's team is world-class, right? And those folks, you can't walk in and be a newbie, right? And because the plans and the providers and all of the data that flows in between, it's very sophisticated and very nuanced. And you've got to be prepared to make dramatic change. And the state is, as I've mentioned several times, it was a complete overhaul of so much of what they did in the past and pushed them to a whole new space, but it wasn't incrementalism. And this is, a genuine shift where you really want to see savings and you feel like you're delivering a better product. It's dramatic change, and it takes real time and real energy and effort, and it's not for the faint of heart.
So in your opinion, it's easier to make that bigger dramatic change than to go incrementally?
Without a doubt.
Really?
Yeah. It's the only way to do it. And you're going to get told you're not allowed to have the data. You're going to get told we don't provide that level of transparency. It's proprietary to us, even though it's on your employees. And pushing through that and being ready to make changes to different administrators or different plans, that's the level of change this takes. And I think that signals have been sent in the market, and we are frankly seeing an unfreezing of a lot of this data transparency in pockets of the country right now. Other places, zero. And the answer is no. And in some employers and some, folks that are trying to push forward just run into these walls, and it falls apart sometimes. And it is tenacity and going through and being willing to carve out or find another way. It's the only way to make progress. And yeah, we support it. And there's a lot of other folks that are helping support to make that happen.
That takes a lot of guts for a state to do that, Kevin.
Well, look, and I'm an elected official, and most elected officials spend their life trying not to annoy anyone.
Right? That's what I'm saying. That takes a lot of guts.
But I really believe, why have these offices if we can't do something big with them? And the politics takes care of itself if you get the policy right. So.
All right. Well, you guys, congratulations on this, on earning this designation from CMS, the Advanced Alternative Payment Model designation for your episodes of care plan for the under 65 market. First one ever. That is so cool. So just seminal moment in value-based care. We will look back on this in years and see how this all kind of started. Maybe this is the tipping point. Let's hope it is. Last thing for you, Kevin, real quick, for this state, what is your, final thoughts for you in terms of what you hope that this change and this designation and this opportunity to kind of move forward, fast forward for me, 4 years from now, what are you hoping this looks like for the state of Connecticut?
Yeah, no, in addition to improving quality and rationalizing costs and all of those things, I hope it heals some of the fractures that have occurred in that delivery system over time. And I hope we have an internal conversation with ourselves about where is the value in our delivery system. And if you've got $100, what buckets are you going to put it in, right? Are you going to put it in your doctor's bucket? Are you going to put it in a health insurance company's bucket? Where do you want to put those dollars? And then make policy decisions accordingly. So I hope it starts a long and I hope important and fruitful conversation as we go forward, long after I'm out in the wind.
Well, we will be watching this very closely. Kyle, I'm sure I will be checking back with you too. Thank you so much, both of you, for stopping by to explain this to us. I mean, I know my audience, they're wonderful, and they love to understand what's going on with payment model, because I think we all know, especially as innovators, it's like you got to follow the dollar in healthcare. I mean, so it's like it's very important to understand, what's some of the future thinking or what's coming down the pike in terms of the way that we're paying for care, and to see an organization like the state of Connecticut adopt an alternative payment model, like that's really exciting. That's very exciting stuff. So Kyle, thank you so much for bringing Kevin to the table to talk with us. Appreciate you guys both for being here. Thank you so much.
Thank you, Jessica.
Thanks, Jessica.
All right, for more with the who's who of health tech, healthcare innovation, and hey, payment model innovation too, check out my YouTube channel over there at youtube.com/WTF Health, or just hit subscribe at the bottom of your screen right now. Kyle Armbrester, the CEO of Signify Health, and Kevin Lembo, the state comptroller in the state of Connecticut. Thank you so much again for joining us. We'll talk to you guys soon. Check back with us, okay?
Sure will.
All right, thanks so much.